the whole thing about the last 2 decades of the Women's Health Initiative. I'm curious if you have any insight into when that first came out in July of 2002.
It was July
Um,
2002.
about
July
this
9th was the fateful
July,
day.
yeah, the fateful day. If you have any insight about, was it just because that fateful day has been the start of 2 decades of misinformation, not only in patients, but more consequentially in physicians as well, to the point that,
Right.
now to this day, they think it's such a strongly ingrained thing that that estrogen drives breast cancer. I myself, only until I got out of residency, have started to understand hormones in a way that I was never taught before. So I'm curious about what you think that initial driver was. Was it just wrong analysis of data? Was it a type of maybe a political involvement in the results of that data? Do you have an insight into what started that whole thing with the Women's Health Initiative and publishing wrongly?
That is such a great question. I have thought about this question over and over and over again, because even the most well-intentioned physicians who are publishing data on, for example, there is an incredible, she used to be a breast cancer surgeon and now she's a breast pathologist and deals with breast cancer, and she's championing testosterone in women. And I love her work, Dr. Rebecca Glasser. And I'm putting on a big Let's Talk Estrogen, Safe or Dangerous free evening on February 15th. And I had invited her. So we started chatting with each other. And it's going to be David Brownstein, David Rosensweet, Angela DeRosa, all of us seasoned working with with hormone patients for 30 to 50 years. And I invited Dr. Glasser to consider being on there. And she said, well, I don't really want to do that because I think estrogen drives breast cancer. That's why she's mainly using an aromatase inhibitor with testosterone. And even she feels that way. It is really ingrained in the American med school psyche. But yet in Europe, they did not go that route. With the Women's Health Initiative, was, usually medicine, the whole trajectory of medicine doesn't change with one small or two small studies. It usually takes a trend of studies and meta-analyses, which are large grouping together of similar studies to see the trend of a path of understanding how things are. In Europe, one, they didn't use synthetic versions. They didn't use Prempro. They used estradiol. And in Europe, they were surveyed, many gynecologists, and they said, well, just because there's this one small study, we're not going to stop using hormones. And in fact, there's now multiple countries in Europe that are socialized countries. Finland was the first country where they pay for everything. So they're very invested in patients staying healthier longer. And they've done research, and the women who take hormone replacement get less cancers, less heart disease, less dementia, and they cost the country less. So then all the rest of the Nordic countries joined in, and then Wales joined in, and then Greenland joined in. And then 2 years ago, Britain joined in a sliding scale. So many European countries offer for free hormones to women when they become menopausal because they stay so healthy, they cost the country less. At the very same time, overlapping with the United States, where we're teaching our physicians, like you learned that hormones drive cancer, when actually they protect. So I ask you, Mother Nature never does anything without a reason. So why would Mother Nature make the very hormones that drive humanity be pro-carcinogenic? It makes no sense. And if estrogen really drove breast cancer, we'd have more cancers when we're younger. They all say estrogen drives growth. Well, estrogen's the oldest hormone on the planet, and hormones speak to a receptor, which is like a satellite dish waiting for its signal, and then they signal genes, which is why genes hold all your archival ancestry information, and only hormones, as well as vitamin D, can signal genes. And so estrogen's the oldest hormone on the planet, according to Dr. Michael Baker, who was one of my consultants for my most recent book, Sexy Brain, on how pollutants are assaulting our hormones, and that's leading to gender bending and gender confusion. But
Mm.
so because estrogen's so old, she has many receptors. And each of these receptors, when they're signaled, have very different actions. So I worked at Tulane with the scientists who discovered these receptors. So Yanaki Gustafson, who discovered the second receptor, estrogen receptor beta, he says this is our own natural chemotherapeutic agent in our body. It is our anti-proliferative agent. You want ER beta signals. It is anti-cancer, cancer protective signaling. So to just say that estrogen drives cancer is not appreciating the nuances and the multiplicity of receptors. It's a very guttural, it's actually it's like kindergarten hormone level of understanding. And the other thing is that there's two major cancer protective natural chemotherapeutic agents in the body. One, when estrogen signals ER beta, and the receptors are named by the alphabet. So alpha being the first receptor and beta being the second receptor.
Right.
And as hormones are metabolized, if you can methylate well, the final metabolite of estrogen, 2-methoxyestradiol, is an incredible anti-cancer agent. So you want to know as a physician, how is my patient metabolizing their hormones? And are they making these natural cancer protective components of estrogen on their own? That's how you look at estrogen to know if it's balanced, and give estrogen to a patient in a way that signals all these receptors and makes sure that the cascade of metabolites keeps that patient safe. But to say that estrogen drives breast cancer, but I worked at Tulane also with John and Benita Kazanellenbogen, and the Kazanellenbogens, which is quite a mouthful of a last name. They along with Elwood Jensen, who discovered the first receptor, they all won the Lasker Awards because that's how breast cancer is profiled. It's all based on their work. ER positive, PR positive came from their work. So they say, yes, there's always been these two tracks of theories. One, that estrogen drives breast cancer, and two, that it has nothing to do with estrogen. Estrogen's protective, in fact, but it's cancer stem cells that drive cancer and recurrence of cancer. But they're scientists, they're not clinicians. So there's always been these two different theories. But in essence, there's now so much data, especially from the reanalysis of the Women's Health Initiative, that estrogens protect the breast. They don't drive cancer. And what's really drives me crazy is that right before July 2002, when in the United States, we pretty much stopped recommending estrogen for many women, especially if you're a high-risk woman, up till that time, there were 26 studies, Dr. Omar, where they gave breast cancer patients who were ER positive right at the time of diagnosis estrogen replacement so that they maintained quality of life while they're going through cancer treatment. And they had to have mild or moderate cancer. They couldn't have stage 3 and stage 4. And they were tracked with a comparison cohort. So they had a placebo arm. And in none of those 26 studies, one was run by MD Anderson, one was run by the University of Wisconsin, one tracked women for 30 years, one tracked women for 24 years. Avram Blooming ran a study tracking women with breast cancer, giving them estrogen for 26 years. Some of them were 4 or 5 years. So it was a compilation of studies. And in fact, I just sent that whole slide deck that I have because I lectured on that at the International College of Integrative Medicine a few years ago, saying there were 26 studies before estrogen got a bad name, where they gave estrogen replacement to ER positive breast cancer patients. They tracked them. None of them fared worse. And in fact, in the majority of the studies, they fared better. And if they got a recurrence, they tended to have less death from that recurrence than a woman who wasn't on estrogen. And those studies have been forgotten. So I sent them to Dr. Glasser and I said, I'd love to chat with you about this, but please take a look at these studies. And Avram Blooming has written a book called Estrogen Matters. He talks about these studies and his own study, and that he feels, he's an oncologist from Southern California. In fact, he's the oncologist that before him and his group, if a woman was diagnosed with breast cancer, she'd have such invasive surgical intervention that most of her upper body and torso was hacked away. So
Yeah.
early breast cancer intervention was horrific. It was almost like Frankenstein, because they didn't just take conservative measures with surgery. And because of him, and it wasn't an easy path for him, he was able to shake the shoulders of orthodoxy and say a woman can get a lumpectomy and chemo and radiation, and she can live just as well as a woman who's getting all this invasive surgery. And he changed the course of surgical and treatment intervention for breast cancer patients. And now he's trying to do this with estrogen. So he wrote this book called Estrogen Matters. And I summarized a lot of this information in a little ebook on my website, because so many women don't know this and so many doctors don't know this. And it's a shame. And the problem is, so you go back to your question, why did this happen? If this is the science, why is medicine going off on this different direction? And if you would have asked me this a few years ago, I would have said it was mostly misunderstanding and misinterpretation. But now there's been such clear research. In fact, the largest study ever run on hormones, it's still in peer review in a British Medical and Yale composite journal, but it's the 7 million Medicare study where they looked at our NIH and our National Library of Medicine looked at 7 million Medicare patients. So we have all their records, all the detail of their records. And they said, how many are on estrogen? 1.5 million women were on estrogen. So they looked to see how they got it into their body, their dosage, what they took, and then they looked at endpoints. They looked at 5 cancers, with breast being the most important one for this discussion. And then they looked at longevity and heart issues and cognitive issues. And women on estrogen had statistically less of all 5 cancer: breast, uterine, ovarian, colorectal, and lung. Totally less. That's the largest study ever run. And the data now is enormous. So now, after the pandemic, if you ask me this question, and I hate to say this answer, and I believe that a woman not on hormones, because we live longer, we live a third to a half of our lives in menopause, which is a new thing in humanity, although our life expectancy in the United States has gone down 3 years in the last few years. I believe that we are run by big pharma, and they want us to need bone meds and cognition meds and put us in the nursing homes. So we have this pharmaceutical industrial nursing home complex that is making money off of keeping us sick, because women on hormones are less sick and cost us less, such as the socialized countries in Europe have been seeing it. I never thought I would be what would be called a conspiracy theorist, but how do you come up with any other answer of how people aren't? And women on hormones feel better, look better, act better, but they have less breast cancer.